In numbers, this is what smoking has done to human health around the world. Does the world need more causes of death? Death besieging the globe from every side, and therefore we must preserve our souls as much as possible from the things that a person practices and he is aware of their harm to him and does not care about that, and data indicate that 8 million people die every year as a result of direct consumption of tobacco, while around 900,000 non-smokers die from passive smoking. On May 31st of each year, the World Health Organization and global partners celebrate World No Tobacco Day, and the annual campaign provides an opportunity to raise awareness of the harmful and deadly effects of tobacco use and exposure for secondhand smoke. Discourage tobacco use in any way. Cigarettes kill more than 8 million annually. The diseases associated with smoking cigarettes cause the death of more than 8 million people around the world annually, while half of the addicts of various types of tobacco die due to the smoking habit, and according to information from the World Health Organization data, the Republic of Kiribati leads the countries of the world in the percentage of addiction to smoking cigarettes among its citizens, and reaches the proportion of smokers in the country, with a population of 116,000, is 52.4%, and diseases linked to smoking cigarettes result in the death of 200 people per day. The Republic of Nauru is second, with a percentage of 47.50%, followed by Serbia with 41.65%, Russia with 40.90%, Jordan with 40.45%, and Indonesia with 39.90%, while Turkey ranks 40th in the world with 25.95%. As the information shows, the number of smokers around the world, amounting to 1,100,000,000 people, 80% of them in low and middle income countries. It is reported that since 1987, the World Health Organization has celebrated World Smoking Cessation Day on February 9th of every year. A person dies every 4 seconds. The World Health Organization said that tobacco is a serious danger that surrounds smoker and non-smoker, as a person dies every 4 seconds because of tobacco worldwide, and the organization warned against smoking tobacco and secondhand smoke from tobacco that causes serious diseases such as cardiovascular diseases, lung cancer, chronic obstructive pulmonary disease, asthma, and tuberculosis. Dr. Vinayak Prasad of the WHO's Non-Communicable Diseases Department emphasized the risk of damage caused by tobacco to the lungs of smokers and non-smokers alike, as 3.3 million deaths related to tobacco are caused by lung diseases, such as cancer, chronic respiratory diseases and tuberculosis, with more than 40% of all cases. Adding, of the 3.3 million people, there are about 500,000 who are exposed for secondhand smoke and die from it, and among children under the age of 5 years, 60,000 children die every year from passive smoking. Quote: the latest national surveys on tobacco consumption, Stepwise 2017, indicate that nearly a quarter of the adult population, 22.7%, are current smokers. And that percentage rises among men to 43.4%, while nearly half of the population, 49%, is exposed to passive smoking in homes. National studies also revealed that approximately 63% of university students are exposed to passive smoking in their universities, and 47% of them are exposed to it in their homes, as estimates globally indicate that 165,000 children died before their 5th birthday in low respiratory infections caused by secondhand smoke from tobacco. Smokers spend more than $900 a month. A pack of cigarettes in Australia is considered one of the most expensive in the world, where the average price of a box containing 25 cigarettes reached $30. This high price did not change the reality of the smoking scene in the country, where about 21% of adults in poorer areas smoke compared to 6.8% in wealthier regions. Kamalas explains this phenomenon by saying, awareness campaigns in rich areas are much stronger. For example, there are certain areas in the North Shore in Sydney where municipalities prohibit smoking abroad or are too restrictive that it becomes prohibited even in markets and parks. This is not found in the Arab-majority areas. Those who smoke 1 pack of cigarettes per day spend an average of $900 per month, which equals $225 per week. The ranking of Arab countries according to the number of cigarettes that an individual consumes. While the percentage of smokers decreases constantly in developed countries, the percentage of smokers in developing countries increases constantly, and Lebanon came first in the Arab world and the third globally, with 3,023 cigarettes per year per person, and Jordan ranked 16th globally with 1,855 cigarettes per year per person, while it replaced Tunisia ranked 26 globally, with 1,628 cigarettes, then Kuwait ranked 31, with 1,517 cigarettes, and Saudi Arabia ranked 37 globally, with 1,395 cigarettes, and Libya ranked 43 worldwide, with 1,332 cigarettes, then Egypt ranked 49 globally, with 1,215 cigarettes, and Iraq ranked first 50 globally, with 1,181 cigarettes, Algeria ranked 59th globally, 1,041 cigarettes, and Morocco topped the list of Arab countries, where it ranked 79th globally, with 679 cigarettes. According to several scientific studies, smoking contains many components such as nicotine, tobacco, and these components constitute a danger to health and affect it negatively, as one cigarette contains 600 different components, and when these components are burned, a reaction occurs that produces more than 7,000 chemicals in general, of which 69 are carcinogens. Cigarettes are no different from hookahs, both of which have high levels of carcinogens and toxins, and smoking causes shrinking arteries in the legs and arteries of the arms, a phenomenon known as vascular disease, and includes the category of people most at risk of peripheral vascular disease, many the elderly and smokers, who increase their risk of this disease or heart disease. This scourge destroys health and money at the level of the individual and at the level of the state that spends huge sums on studies and health centers to try to fight this scourge, and also as a reason for environmental pollution. We do not find one advantage to it at all, and everyone agrees on that. In the last statistic that showed that more than 20% of the youth category 13 to 15 who smoke worldwide, every day there are between 80,000 to 100,000 children who start smoking, and half of them continue to smoke until 15 to 20 years.